Hello. Looks like we're still connecting, but my name is Jacob Wilson. I'm the Nova Scotia NDP candidate for Bedford Basin. And with me here tonight are Dr. Hasan Sheikh and Dr. Brandon Doucet. How about you folks introduce yourselves?
Sure thing. So I'm Dr. Hasan Sheikh. I'm an emergency physician and addictions physician in Toronto. And I'm also the vice chair of Canadian Doctors for Medicare, which is an organization that advocates for kind of protecting our public healthcare system, but also advocating for a better Medicare, one that fills some of the gaps that are in our current Medicare system.
Okay.
And I'm Dr. Brandon Doucet, so I'm a practicing dentist in Nova Scotia. I'm also the founder of the group Coalition for Dental Care, which is a group that highlights the shortcomings of our existing dental care system, as well as advocating for a more humane alternative.
Great. So glad to have you here tonight. This is clearly like a really important topic. Canada has the second lowest public spending on dental care within the OECD countries. So we're behind Spain, or we're ahead of Spain, but we're behind the US and the UK. Also, it's been found that poor oral health is causative of other preventable medical conditions and diseases. So it's a really important step in preventative care for folks in their proper health care. So the Nova Scotia NDP has proposed and promised to have a public dental program in schools, similar to the medical care that students receive for speech language pathology and other services, with oral hygienists and public medical professionals. But my guests here today think that this should go further, and I'm really glad to have them here to talk about what their vision for dental care for all Nova Scotians and all Canadians is. So, let's get into it, folks.
Awesome. So if you don't mind, I could get started with maybe just some of the statistics of where we currently are with dental care in Canada. I think that might be a good kind of launching point to give people some perspective.
Absolutely.
And when we talk about dental care being private in Canada, what we mean is that people rely primarily on work-related insurance and out-of-pocket payments to access dental care. And in this sense, dental care in Canada more closely resembles, say, the private American-style healthcare system more than it resembles our universal healthcare system, because not everyone has access to these services. There's very high costs, and the people who need help the most often have the hardest time accessing care. So to put some numbers to this, the overwhelming majority of dental spending at 95% is private, so through work-related insurance and out-of-pocket payments, whereas only a meager 5% of dental spending comes from targeted government dental programs. And as Jacob mentioned in the beginning, that's a very low level. And when we compare it to other countries, say in the OECD, which are other developed countries, we see that Canada is actually the second worst, only to Spain. And it's even worse than the Americans, where they spend about 10% of dental spending being public. So we're really an outlier on this issue. And it's something that if Canadians take so much pride in our universal healthcare system, because we want that equity and everyone to have access, I think it's essential that dental care be included.
Mm.
Yeah, and just to build on what Brandon mentioned, not only are we one of the lowest spending countries in the OECD, we're actually going in the wrong direction. So many of our peers are actually increasing their share of public dental spending while Canada is decreasing it. So we peaked in the 80s at around 20% of all dental spending being public, and we've just been slowly eroding the public dental care that we do have to this low of 5%. And these statistics can seem, sometimes hard to wrap their head around. So why don't I tell you a story from the emergency department?
Absolutely.
It's
Go ahead.
pretty frequent that I will walk into the emergency department where, waits are multiple hours, people are in pain, and people are scared and anxious. And I'll pick up a chart of a patient who's come because of a toothache or a dental complaint. And I have to be honest, often I'll kind of let out this big sigh of just frustration, because it's heartbreaking to know that I'm going to see someone who I don't really have the tools, expertise, or equipment to properly diagnose or properly treat their issue. But the saddest part of it is that the patient also knows that when they come to the emergency department. So pretty frequently I'll walk in and I'll do my assessment with patients and I'll say, well, ultimately you need to see a dentist. And people look at me and they say, yeah, of course I do. If I could see a dentist, I wouldn't be here. And so, people are getting really suboptimal care because we're not actually treating the issue that they need treated. They're not seeing the providers that they need to see, but they are now having to, make do and go to other resources that are publicly funded, like our emergency departments, because they have nowhere else to go. And so it's a strain on the system. It's not the right place or the right way of providing care to patients. And basically, it's a lose-lose situation.
I think just something briefly to add to what you're saying as well, as far as dental spending going in the wrong direction, as far as public dental spending decreasing over time, I think it's important to contextualize the moment in which these things are happening as well. So just to give some general statistics is that, about 1 in 3 Canadians lack any form of dental insurance. A little over 1 in 5 people avoid the dentist each year because of financial constraints. And this is kind of the backdrop for dental care spending decreasing, is that these numbers that I'm mentioning are actually getting worse. So even before the pandemic, if we looked in changes in the economy, what we're seeing is 2 things. One is that there's a lot of people retiring and losing their work-related benefits, but also a lot of people are now working in the precarious gig economy that doesn't provide benefits like dental insurance tied to their labor. So even before the pandemic, we're seeing access to dental care getting worse. And now with the COVID-19 pandemic, people are going through immense financial hardship. They're really struggling to make ends meet. People are losing their employment. They're working reduced hours. And it's something that when you become unemployed or you have fewer hours to work, you lose your work-related benefits, or you're also losing out-of-pocket payments and like disposable income to be able to pay for these things out of pocket. So this arc of public dental spending going down is also at a time where access to dental care is getting much, much worse.
Do we have any, so what are the trends here in Nova Scotia? I know that there was some MSI coverage for dental care for some time, but I think the trend has continued. But this hasn't been one of the areas that I've been really up on. Yeah.
So some of the public dental programs in Nova Scotia, so there is a children's dental program. I believe they cover up until the age of 14. But one of the problems with the existing programs in place, whether, I'll start with the children's programs, but then I'll maybe go to some of the other ones. Starting with the children's program is that children are only covered under the public program if they don't have private dental insurance. So what we see is that the private plans actually pay out a higher amount than the public plans do. So what ends up happening is that there's a preference for dentists to treat people on the private plans because they'll make more money doing that, rather than children on the public plan because the fees are lower that they pay out. So what we end up seeing is a tiered system in this sense, because you have, technically all children have coverage, but if you rely on the public system, it's much harder to find a dentist who's going to accept you, or you don't get charged extra. And we see a similar trend as well, say for people on social assistance or people with disabilities. There is some coverage for those people. Often it's far less than what people actually think, with these programs tending to favor extracting teeth rather than saving them, and very, very skimpy on preventative services. But oftentimes, even the people who have those targeted dental coverage often struggle finding a dentist who will accept them. Or if they do find a dentist who will accept them, they'll charge them the full amount up front, and then maybe they'll get paid back a fraction of that on the other end. So you can imagine if you're on social assistance, if your copayment for a dental procedure, say the bill overall is $200 and the social assistance will cover $100 is a lot for you. Some people, that's, their monthly grocery bill. And that means that even though they have coverage, they're not necessarily going to be able to access that care.
Mm-hmm. So I guess, I have to back up one sec. I guess one of the things that I'm wondering is, we have where we're at. We know that like there's been, a long series of cuts, but how is it that we've gotten here? It does seem to me like we've really ignored all the social aspects of dental care and of this health. Like it is, it seems fairly obvious to me as like as a definite layman, is that if you have a broken bone or you have some problem with your skeletal system, you can go and get taken care of that in a hospital and on our public healthcare system. But the bones that grow out of your face are not covered for some absurd reason. Is there anything to this, or is it really just a social and historical trend that we've decided to continue and then has gotten worse in the sort of neoliberal era?
Yeah, and I think that's exactly it, is that this is something that is more of a historical explanation that then we have failed to recognize and kind of intervene on. So, when Medicare was being created in the 50s and 60s, there's actually an interesting historical time from an oral health point of view, because that's when we started to fluoridate the water. And so this led to kind of a sharp decline in dental caries, and the idea that I think the false reassurance that kind of the solutions to oral health problems were individual and kind of not provider based. And so it meant that dental care wasn't something that we're as compelled to include in our publicly funded Medicare system. Part of that was also we just didn't have enough dentists at the time, which is not the case anymore. And as things went on and we went through rounds of austerity, it's always been kind of easy to cut these public programs that fill the gaps, right? When you have these targeted programs, they don't have the same general support as something like Medicare, where everyone knows it, everyone understands its importance to their lives and the lives of their neighbors. And instead, sometimes these targeted programs end up, really feeling like charity as opposed to really what they are, which is essential healthcare for a vulnerable community.
Mm-hmm.
And so, when we set up these programs properly and we provide equitable care to everyone and care that people can access, what we'll see is that, my theory on this is we'll never go back, right? We'll see that it makes way more sense. People are getting better care for lower costs, and it just makes so much sense. We'll never go back. Because you see what happens, our dental care system here, as Brandon mentioned, is so similar to kind of the system in the States, where it's, so many different types of programs and insurance companies, and there's just a ton of waste when it comes to that in terms of administrative costs and arguing with insurance and that sort of thing. So I think it's much more of a historical piece and something that we really need kind of bold upfront investment by our policymakers and politicians to really get us on the right track going forward.
Yeah, I mean, it was mentioned by one of the folks in the chat that they have dental insurance in both the US and Canada, and their experience in both systems have been exactly the same. And, I think we've definitely gotten very complacent in many ways here in Canada, saying, oh, we're better than the United States. Like our healthcare is better than the United States. But as you pointed out, we don't even have a comparable level of public expenditure on dental care. And as another person is pointing out that they haven't had, Kayla hasn't had health coverage in over 7 years, and it includes through work because health insurance is not included in contract. Cost of insurance on her own is over $250 a month. She can't afford to fix her teeth, and several dentists don't accept a payment plan. It's like, I don't have dental coverage right now, not least of which is because I'm on leave to run. But yeah, and also pointed out that Kayla is First Nations, so society presumes that she has coverage through tax dollars. So I think I was sort of going from a class perspective here, of like how, like I'm working class. I've been working class for a while. When I was working construction, I had dental coverage for a while, but it was really hard to like make it to use it, even up to my full coverage. And then like now that I don't have that, it seems like a big problem. Like, okay, how can I even afford to go in for like cleaning? What if they find something? But I think that there's another element here, which is like the extent to which people are precluded, especially if it's on the basis of employment, from even accessing those services because of the systemic racism that we face in our society. So, Hasan, I think that we should absolutely get onto the effects of policy, what policies are being proposed, and bold action. But I think could either of you talk for a minute about the intersections of class and race and indigeneity with dental care, and also with the sort of broader health outcomes that has?
Yeah, I don't mind talking about this for a moment. Actually, I'm in the process of writing a book about dental care in Canada, and that's actually something that I touch on in the book. Is just looking at the nature of work-related dental insurance, and also who are the people who tend to have access to that, and that tends to be people who are in higher paying jobs, who are more well off financially. And what we see because of structural racism in our society is that people of color tend to experience poverty at higher rates than the white majority of the population. And what we see there is that because of that, they're less likely to have dental insurance. They're less likely to have the out-of-pocket payments to be able to access dental care. And as we're going to get into as well, the lack of access to dental care is it's one of the big components that helps trap people in the cycle of poverty, which is really hard for people to get out. Because when you have a tooth that has a cavity in it, it doesn't go away. It just gets bigger and the problems compound. They get worse. They become more expensive to deal with, and all of the other implications to that. And also, when we look at the nature of work-related insurance as well, within the sense of our society is very unstable, and we see financial downturns on average every 7 years or so. I know in my lifetime, we've seen the dot-com bubble crash of 2000, the housing bubble crash of 07, 08. I'm sure there's another one, and then COVID in 2020. And it's something that when that happens, there's severe financial hardship that people face, and people of color tend to be the people who disproportionately bear the brunt of that financial hardship. And that means they're going to lose employment, they're going to lose their dental insurance if they were lucky enough to have it in the first place, and they're going to lose disposable income to be able to pay for these services out of pocket. So I very much see building a universal dental plan as an kind of an anti-racist policy as well, because you're lifting the floor up so that everyone has access to dental care, and acknowledging that certain groups disproportionately face these problems more than others.
Yeah, and to add to that, we have good data that when we look at who experiences the highest burden of dental disease in Canada, it is marginalized communities, it is low-income adults, seniors, Indigenous communities, refugees, people who live in rural areas, and people with disabilities. When that stat that Brandon mentioned earlier of 1 in 5 Canadians, don't see a dentist because of cost, that's actually 2 in 5 low-income Canadians. So we see that it's twice the amount that the average of when low-income Canadians really aren't seeing a dentist because of cost.
Yeah.
And part of that is our lack of public funding, but part of it is also a lack of proper public delivery of dental services. So if you think of someone running a private dental practice, it's going to be very challenging for them to even with public funding, to see certain patients, for example, someone with a developmental delay or a complex disability, which may take way more time and need far more kind of wraparound services to properly provide the right care. And even if we publicly fund certain services, if we don't create the right resources that actually provide care in places that people can access, we're going to have trouble still. That goes for remote communities, Indigenous communities, And we need both a combination of that increased public funding, but also public delivery. And the beauty of the public delivery models is that they can also be cost saving. They can use providers like dental therapists that can really reduce our costs and provide high quality care at an affordable price to the system.
Mm-hmm. Yeah, two sort of important things that were raised as well is that it's not being Black, Indigenous, or a person of color that's the barrier. It's white supremacy and capitalism, and like that is absolutely like an important thing to center here. And then I think it's time to sort of get into some of the policy stuff. But just while I was listening to you, Brandon and Hasan, like it also like this seems really simple, but if just going into like a job interview, if you're missing teeth, there's all kinds of assumptions that are going to be made, or if you're missing work because of oral pain or other conditions, like it creates another trap in socioeconomic status that further reinforces these forces of exclusion, of active white supremacy as well. It reinforces negative stereotypes. It reinforces like class barriers as well. So I think it's not really overstating it to be like that this is like a case study. But yeah, I guess we've established that it's pretty bad. Like I mean I don't like to laugh at it, but like we've here established like this is the problem. Hasan, you started to gesture towards some of the solutions. So I guess, yeah, where do we go from here? I mentioned earlier the public provision in schools, having oral hygienists, having public dentists, like providing care to folks in the school system. But I think we see from the scope of this conversation that more is definitely needed. And so what do we need and how do we get there from your respective organizations' perspectives?
So it might be good to start off by talking about what the Coalition for Dental Care is advocating for, and then maybe we can go into some details as far as what the Nova Scotia NDP is proposing, what the federal NDP has proposed, and some historical programs that's been in place to help accessing dental care. So really, the Coalition for Dental Care wants dental care to look very different than it does now. Fundamentally, we want dental care to be part of a universal healthcare system. So that means everyone is guaranteed dental insurance throughout life, from birth to death. And what that does is when you go without dental insurance for a period of your life, you neglect routine care to focus resources to deal with pain and infection and more immediate problems. Whereas guaranteeing insurance throughout life means people can access those preventative services more routinely, which means people in society as a whole is going to have better oral health. We'll talk about some of the benefits and consequences of that later on. And then also, it eliminates the discriminatory tiered system that we have with the targeted dental programs in place now, where dentists prefer to treat people with quote unquote good insurance from good private healthcare plans. And the people who rely on targeted programs, such as Indigenous communities, tend to be lower on the priority list of dentists because the fees they pay out are much lower. Also because of, I'm sure, racist sentiment among some of the dentists as well. And it's something that when we look at a dental care system, we also need to learn from our universal healthcare system and understand that just having dental insurance doesn't guarantee that you have access to a dental provider, as Hasan has mentioned, where we should also look at the public delivery model to increase access to dental care. And what that means is with our universal healthcare system, we have public funding of private clinics, and that would be what an insurance-based system would largely entail. But I think we can actually benefit from this and bring a robust sector of public funding of publicly owned dental clinics to service particularly the communities that are most marginalized and have the hardest time accessing dental care now, with further growth potential to other populations as well. So we think that publicly owned dental clinics should be in places like schools, long-term care facilities, prisons, and Indigenous and community health centers. And it's really something that these are very easily accessible and actually bring dental care to the people who need it in a more organized fashion than the private practice model. Because what we see with private practice is a lot of dentists want to live in cities where they can focus on luxury and cosmetic procedures, and a lot of rural and poorer communities tend to be marginalized and underserviced. So this public delivery model helps treat those populations in a more efficient manner. And also, as Hasan mentioned, we can pay those providers on a salary rather than the more expensive fee-for-service basis. So that allows practitioners to take the time and energy needed to treat people with more complex oral health needs. You can imagine it's going to take more time and energy to treat and do a filling on an autistic child than to do one on a typically developing child. And because dentists are paid on a fee for service, they're actually disincentivized from treating those populations that take more time and energy. So having that salaried approach is a great way to help ensure those populations get quality care and that they don't fall through the cracks.
Mm-hmm. Yeah, I mean, it's the same as like why piece workers in trades, like, yeah, they can really zip through a bunch of stuff, but it's not going to be the same amount of care necessarily. I mean, no shade on drywallers or whatever who's piece workers, but like, having that salaried approach is definitely a great way to ensure like that attention is being given. Yeah, definitely. Like you've got it for me. Like I understand that. So I guess the thing that this brings to mind for me is the ways in which, like, when we make programs universal, they're more popular, they're more accessible, they're more utilized, and harder to sort of claw back. As we sort of introduce this sort of two lane model, how do we build lay the groundwork for the extension of this to a fully universal system?
So in my mind, I think we need to start building power, and that can start happening either at federal levels or provincial levels, where some momentum starts happening around dental care. And to bring dental care fully under our universal healthcare system, this can happen in multiple ways. One of them would be, let's say, for example, at the provincial level, a government gets in power, let's say the Nova Scotia NDP, and they want to institute a school-based dental program. Great. You can start expanding existing targeted programs, preferably making them to some extent universal. So instead of just children from low-income families, but all children, and trying to expand programs in that sense, and also trying to negotiate with the federal governments for some sort of cost-sharing agreement. Or this can also be initiated through the federal government as well. This would likely happen under some sort of minority parliament where, say, the Liberals hold the minority with the NDP holding the balance of power would be the likely case scenario. And what that it can negotiate is that, let's say, under our current Canada Health Act, in order for the provinces to be eligible for help funding their universal healthcare system, which the provinces rely on the federal government a lot for help, is they have to meet certain criteria in order to be eligible. So some of these criteria: comprehensiveness, accessibility, portability, universality, public administration, all of these great things that ensure our public healthcare system meets certain standards. We could do the same thing with dental care, where the federal government goes to the provinces and says, hey, we're going to help you out a lot. We're going to give you a lot of money to have a public dental care program, but you need to meet these criteria. And I see either of those ways could be the way in which we bring dental care under our universal healthcare system. I'm not, I can't predict the future, so I don't want to make a guess for one or the other, but I see those as being kind of the two main lanes in which this could happen.
Yeah, I think, go ahead, sorry, go ahead.
I was just going to say, I think ultimately it will come when we as a community demand it. And I think that that kind of coalition building is so important. One of the things I'm really encouraged by is the number of people that participate in these sorts of webinars that we give, because you see just how pervasive this issue is and how deeply it affects people. And as we talked about earlier, the people that this affects the most are the people who currently do not have the same power in our society. It is people with, lower socioeconomic power, and as we talked about, having kind of suboptimal oral health can really affect your self-esteem, your participation in the workforce, your participation, I think, also in the political process, right? And so I think that's why it's important that we build these coalitions and that we really demand that this is an issue that we take seriously and that we invest in publicly.
I think one thing to add to, from my experience within the dental profession itself and within the dental public health community, I think my experience working with the public, we tend to see that I think like the public is far ahead of the politicians and ahead of the academics in this. I think the academics tend to be, let's make minor tweaks around the edges. Whereas I think in reality, a lot of people in the public, they're yearning for something bold and innovative when it comes to dental care. And when I talk to people and they hear of the idea of dental therapy, which is basically a dental provider that can do things like fillings, simple extractions, cleanings, all of these things at a fraction of the cost of a dentist. And they hear the fact that like, oh, a filling could cost $120 instead of $250. That's amazing. Why don't we have like one in every single community in the country? And like, I think people are very on board with these kind of things, and they tend to be ahead of the politicians and ahead of, ahead of the rest of the population as well. I see a comment here as well, addressing like the term typically developing child as well, for children with autism. I think what I was trying to say there is that you could imagine trying to do a filling on a child who isn't cooperating very well in the dental chair, and it's going to take a lot more time and energy to achieve per unit, to do a filling versus other children. So, I'm sure there's some children who have autism who are going to do great in the chair, whereas other ones, they're going to require sedation. They're going to require more complex behavioral management than others.
Yeah, I mean, I think it is important. Just while we're on it, and I think we should spend a brief second here, saying that like autistic folks are typically developing for for themselves, and I think there can be certainly sensory issues, especially with a situation like dental care, and I appreciate. I appreciate the correction in the comments here. I don't want to like get into a large thing about autistics accessing this, although we can certainly have a discussion about neurodivergent folks accessing care. But I think it's an important correction to make in terms of like the broader implications of assuming that neurodivergent people aren't developing typically. They're just So I thank you, Kayla, and I do think we can certainly have this discussion a little bit on the chat if we need to, but I appreciate you intervening for that, because it is really important that we recognize neurodivergence being like a real thing, and not assuming neurotypical folks experience medical care in the same ways or to the same quality and standards. So I appreciate that. Sorry if we got a little bit off here.
I think something to add to that is just like stressing the importance of having the salaried dental providers being able to take the time and energy needing to treat people with more complex oral health needs, who need more time to be able to do a filling regardless of, why that is. Dentists shouldn't have to worry, this is going to take me 45 minutes instead of 30 minutes. They should be just see somebody who says they need help. Let's help them.
Mm-hmm. Yeah, absolutely. that this provision of care being public, being salaried instead of based purely on a for-profit model, or like getting folks in the doors, out the doors as fast as possible, is going to ensure a better standard of care. I really appreciate that. We were talking about dental therapists as well, and Hasan, I think you were starting to make a point about that in this system of care and this scheme of care and this sort of plan. Would you care to elaborate a bit?
Sure. Yeah, I think one of the big benefits of having this public financing and public delivery model is that, as Brandon has mentioned, we can provide kind of the most efficient and cost-effective care that treats the right patient in the right place at the right time with the right resources. And dental therapists are a piece of that, because they are providers that will be able to do kind of certain procedures like simple extractions or fillings for much cheaper. And it also will free up the resources that our dentists who are specially trained can do the more complex cases that is better suited to their training. So we're taking advantage and we're matching the right resource for the right person. And we can provide these resources in the right places. So, for example, there's this great, typical Canadian example of a wonderful pilot program, which means, in typical Canadian fashion, it means it worked really well and we never scaled it up. And it was in Oxbow, Saskatchewan in the 1970s. And they used dental therapists in elementary schools to provide comprehensive care to children. And what they found over the course of this, few years I think about 6-10 years that the program ran, is that the costs per child went way down. The number of fillings per child went way down. The number of children that could be seen by a single dental therapist went way up. And it's because you see that there's this backlog of care that needs to happen. But once we do that, suddenly we're setting people up for success, and we're ensuring that every child is getting the right care. And because it's a universal program in the schools, you don't have these kind of class barriers or differences in treatments or seeing it as some sort of handout to certain communities. This is important for your health. Let's set you up for success for the rest of your life with good oral health and give you the care you need.
Yeah, great. Go ahead, Brennan.
That Saskatchewan dental plan as well was very, very successful, as Hasan was saying, using the salaried dental therapists. And it was later privatized to be an inferior private practice fee-for-service based program. And you could actually see the health of children's teeth in the province of Saskatchewan decreasing as the program was privatized, because those school-based clinics are so easily accessible. A lot of parents, they struggle to take the time off work to be able to take their children to and from the dentist. The children who have the highest dental needs, so they're going to need to take more time off, go to school and stuff like that, tend to come from families who struggle the most to take that time off. They also struggle to get to and from the dentist, particularly in many rural communities. I mean, I worked in Newfoundland the last 2 years or so. I've recently moved, but it would be regular for me to have patients to have to drive 2 hours to come see me. Whereas if those children had a dental clinic in their school and a dental therapist in their community, it's making sure that the people who are most marginalized do not fall through the cracks.
Mm-hmm. Yeah. So in the chat here, Tony Tracy has been sharing some of the sort of proposals and like comments from Jagmeet Singh, Gary Burrell, the Nova Scotia, and the federal NDP. And I think there's we've kind of talked about how targeted interventions can be a good first step. It can be a method to building power. I think there's definitely parallels to Saskatchewan introducing Medicare and then like really forcing the federal government's hand alongside their provincial and federal counterparts in their respective legislatures. I think that my question here is, as an organizer, is what's the tactic? How can the provincial NDP and provincial organizers best leverage the policy options that are available to us to assist the introduction of a plan across Canada? Like, is that something that's really on your folks' radar as well?
Yeah, absolutely. I think it depends on where your levers of power lie. So, if you are working at the provincial level like yourself, then I think really focusing on trying to get a comprehensive universal program, like Saskatchewan did back in the day with Tommy Douglas. And I think that, and if you're at the federal level, I would say, trying to essentially introduce kind of a parallel, Canada Health Act for dental care to really bring the provinces on board. Because as I said earlier, I think just like with Medicare, once we make that switch, we're never going to go back. And Medicare was fiercely opposed by physicians, and I think historically it's something we should be embarrassed about. But I don't know any physicians, or I don't know many physicians that would go back to that kind of American style system of arguing with insurance companies and trying to figure out, how your patient's going to pay for a test before you order it when you think it's medically necessary and life-saving. So, I think it will be the best thing for everyone once we make this switch. It's just going to require a bold first step, and we have to just keep pushing our policymakers and elected officials to take that first bold step.
Yeah, I guess for you, Brandon, as a dentist, what is the sort of state of opposition support like in the dental profession for this policy and for what you're pushing for?
I think, there are definitely people who are on the coalition side, and, there's a lot of dentists and dental students in the group, but let's be frank about the fact that the majority of dentists are not going to be in favor of this, in that it's going to be a similar dynamic with physicians, whether we like it or not. They're going to fear that, there's concern amongst the dental community because the targeted programs that exist now are so meager and the fees they pay out are so low that dentists worry that a universal program is going to be much of the same. So anyone they treat, they're going to get paid basically next to nothing for. And the worry with that, I think from my mind, there needs to be a sense of trying to educate dentists that that's the nature of targeted programs. Whether we like it or not, they are seen to some extent as quote unquote free stuff for people, and they should be grateful for what they have. Whereas when you build a universal program, there's a sense of solidarity in society that everyone relies on this. And then when politicians try to cut funding for these programs, they face very strong backlash from the population because it's seen as an attack on the society as a whole. And when we look at the targeted programs, it's very easy to undermine these programs. A lot of them are just completely de-indexed from inflation. From year to year, the fees they pay out don't go up. Also, in times of austerity, they will tighten restrictions to gain access to these programs. They'll cover fewer services. They're more favor extractions rather than saving teeth. Whereas a universal program, you could have somebody who's very well off financially and somebody who's not well off financially, relying on the exact same services. And I think in that sense, we'd see a big shift in our society as far as distributing dental care to those who need it rather than those who can pay for it.
Yeah, no, I think that's absolutely fantastic. And I think that's really where we need to be going. Healthcare, I talk about this a lot around mental health care, but it really seems like, health really matters from the neck down, because my eyes apparently aren't covered, my teeth aren't covered. If something's going on in my head, it's incredibly difficult to get access to mental health care. I think if we really are taking the perspective, as we should, that healthcare is a human right, this is an important contribution to improve our medical system and improve the quality of care. And then, sort of to your point, Brandon, I think the central thing that's underlying all of this is that when we build our policy and we build our society based on solidarity and mutual care, we're really building something better. We're really building something that's more durable, and we're building something that's more popular, both in the like sort of capital P and lowercase p level or like sense, because we're building something that people are actually using, people feel good about, people feel like they're being cared for. We've sort of talked about the societal and social effects of like just walking into a job interview and having all your teeth. But then also, when you ask Canadians, like we tie our sense of identity almost exclusively to healthcare, and a large part of that sort of as in opposition to the United States. Really, we look at the OECD countries, we look at the rest of the world, and we're nothing special. In fact, we're pretty low on the list. But we really do hold on to and cherish the notions of ourselves as a nation where people can get health coverage. So yeah, I guess that's I'm on board, and I think that if we want to move past these sort of introductory programs, which are very good about making sure that we get children the care that they need to set them up with good oral health for life. I really do want to be on that journey and fighting for everything after grade 12, because I remember the day that all of a sudden I was off of work-based parents insurance, or like I was outside of coverage because of my age. It's a big scary cliff, and I don't want to end up in an emergency room under the able care of an emergency physician with something horrific in my mouth and being unable to access those services. So yeah, so sorry I went on for a bit there, but I just wanted to sort of double underline how important this is.
I think this might be a good time as well, where you're talking about the burden that lack of access to oral health care places on our universal healthcare system. Maybe Hasan, you could speak for a minute on like the relationship between poor oral health and overall health, because when we look at that as well, we also need to take into account that poor oral health in society as a whole affects our universal healthcare system in other ways. And there's many areas of cost savings of having a universal dental plan.
Yeah, absolutely. And, it really is clear from the literature, there is nothing special about the mouth that suddenly makes it not part of your body when it comes to your health. So your oral health is an important part of your overall health. And for many years, we've seen all these kind of associations where we've looked at, people with poor oral health tend to have worse general health. They tend to have higher rates of diabetes and cardiovascular disease. But when we actually look at, well, what happens if we treat people's oral gum disease, what happens to their overall health? We see it gets better. So there's a causative effect, right? When we do comprehensive periodontal treatments, people's diabetes gets better, their risk of pneumonias goes down, their cardiovascular risk category gets better. It's even been shown in certain studies to improve retention in substance use treatments and reduce homelessness. It's really quite remarkable what providing the full comprehensive healthcare, including oral health, can do for people. And so it's just another reason why this should be part of a publicly funded system. There will likely be some cost savings to our system. Right now, it's a fairly common reason why people use the emergency department, and about 1% of all visits are for non-traumatic dental pain. But and we're not really getting a lot out of these visits. We're spending the money without people actually getting the help they need. But we should also be clear, while there will be some cost savings to the system, this will require public investment. And there's nothing wrong with that, right? And we should see it for exactly what it is. It is an investment in Canadians. It would be an investment in Nova Scotians. It is an investment that will pay off down the line in terms of, really good value for money for spending on people's health. And so we should have no reservations about that, and we should not apologize for that this will actually need public investment.
Yeah,
I think
sorry, go ahead.
I just wanted to quickly add, when we talk about public investment as well, I think it's really important to stress the savings that come from lack of pride. You don't have to pay into your work-related insurance as much. You don't have to pay out of pocket. You go get a filling and an exam done. You don't have to pay 20% of it on the credit card. So there's a lot of cost savings in that sense as well. And I think a lot of people, no one would look at the private American healthcare system and say it costs less than the Canadian healthcare system. Their government spends less, in public dollars. But overall, when we combine public and private spending, we actually, the Americans spend way more than we do. So I think with dental care, yes, we need a huge investment with public funding, but it's also going to save people a lot when it comes to their private payments as well. And also understanding the way you can structure, a system when it comes to the taxes is you can use progressive taxation to ensure that people who are more well off are going to they're going to shoulder more of the burden of the cost of a universal dental plan, whereas regular people who might be paying, let's say, $600 a year for dental care, they might only end up paying $200 a year more in taxes, whereas, a millionaire could be paying much more than that.
Mm-hmm. Yeah, I mean, it certainly, it does sort of seem like we're sort of dancing around this sort of idea of like the public provision of a private good frees up private spending for other things. If your employer is no longer being tied to your health coverage, that's a bonus for your employer's, bottom line. Also, if you as a worker aren't having to pay enormous out of cost fees or like avoiding going to get your teeth cleaned because they're going to find something, like that has all kinds of effects. Like I've talked about this a little bit before, but like I've lived in Denmark and much in the same way that like education is provided for free, meaning that people don't have a ton of like debt related to their education. Like that makes their economy more productive, but it also leads to well-educated workers who are more like able to participate in their institutions. Having people with better oral health, having less debt, having employers no longer going through this weird private-based system, like it just really does seem like a no-brainer. Like, I would be very happy if next time I go to get my teeth taken care of, I'm not going to be saddled with an enormous amount of debt that I could be putting towards, other stuff that I would much rather spend my money on than the bones in my mouth.
I think to add to the point you're saying as well is like workers now have to they have to bargain for dental insurance as well. If we look at the state of workers' rights in Canada, they have a lot better things to negotiate. They need better hours, better workplace protections and various things. And taking dental care off the table frees up that negotiating for other things as well.
Yeah, I mean, absolutely. Absolutely. Like if you're going into a union situation and the employer can threaten cutting off your dental benefits, oh, well, then you're going to be focusing on defending those gains that you've rightfully made. But, I'm sure there's far, far better things for the workers' movement to do, as you're saying, than focus on like defending what meager things the bosses have offered to us. So, if we can get this done, it just really helps working people build their power in other ways and in struggles that are, probably more important to them on a day-to-day basis than sort of the contingency health stuff. Yeah. We've kind of talked a few circles around you, Hasan. Do you have anything to add at this point?
No, nothing that springs to mind. Actually, you know what? There is one thing. Because you mentioned at one point that Canadians are extremely proud of their Medicare system, but then when we look at our kind of international peers, we're nothing special.
Mm-hmm.
And that is very true, because when actually you look at our peers, we're nothing special in terms of public spending, and actually we're on the lower end of kind of public spending in a lot of cases, and a lot less than I think most Canadians realize. If you look at our overall healthcare system, only 70% of it is publicly funded. The other 30% is private, and that is things like dental care, vision care, and obviously a huge one in pharmacare, which is another big, kind of issue around improving Medicare. And so I think often we fail to realize just how much of our system is private.
Yeah.
And all of these same concepts that make us so proud of Medicare and all the reasons why it makes sense, these all apply to dental care, and they all apply to vision care and pharmacare. And so it's for these reasons that we really need to be looking at, well, how do we get to that, next phase of Medicare 2.0, in a way that's really going to be, a win-win for society.
Yeah. Yeah. I mean, I ran in the last federal election, and I remember talking to people about pharmacare, and, the stories that you hear are absolutely heartbreaking. I don't know how you can talk to your neighbors about these issues and not come away with the distinct and completely unavoidable impression that we need to make these improvements in order to have a more just, more humane society, but also just like to really care for each other. If we are going to have a healthcare system, I said earlier, it doesn't make sense that it stops below your chin. And, it also certainly doesn't make sense that, people are going and paying inordinate amounts for insulin, and you mentioned, the way that and oral care can help with diabetes, but my partner's a speech language pathologist. We sort of, there's a patchwork there. I think that this one thing that this conversation has really highlighted for me is the scope of the task that comes before us. And I really appreciate the work that both of you are doing. We sort of had some comments coming in here, but I would really, I'd like to open it up to the folks who are watching, and to just ask anything they might have. Of course, we all have our respective social media pages and accounts. So if you guys want to shout those out while folks might be typing in their questions or comments.
If I could add something as well while we're waiting for some questions to roll in, one of the things that I want to mention is when we're talking about making dental care an urgent issue for people, I think, some of the things we need to stress are things we've already talked about, like access to dental care is getting worse, with changes in the nature of the economy and work-related insurance. Also, the financial hardship from COVID, but also looking at the way dental care is delivered as well. What we're seeing is a lot of corporate offices being set up and the big financial firms buying up dental clinics in mass and really turning these into for-profit machines. And I think this is something that often happens in the shadows because dental corporations buy up these practices without advertising that there's a new owner to the clinic. And a lot of the time the same dentist still works there. And it's something that the way dental care is delivered when it becomes this for-profit machine becomes much uglier. And I think Canadians would be very disgusted to realize the extent to which this is happening and the fact that this is even happening at all. I think it's something that, if this didn't happen in the shadows, it would be a huge issue.
No, I wasn't aware of that. And that is it's monstrous, in general, to be benefiting off of people's health, but then also operating in this space where we're having, where you have this sort of quasi-public, mostly private system, and then getting bigger and bigger and bigger in this corporate consolidation and enriching themselves off of the back of, essentially a loophole, a historical oversight that hasn't been included. It's sickening. Yeah.
And dental care is one of those things as well that relies a lot of trust between the dentist and the patient. You're sitting back in the chair, you're in a very vulnerable position. Someone tells you you need 3 fillings versus 2. You really don't know the difference. And it's something that trust is actually being eroded in the population. There was actually a study done a few years ago that showed that the people polled in the survey thought of dentists more as business people than as doctors. And it's something that this transition where we see, you know, I see it sometimes where people will come in for a second opinion. I had this when I was in Newfoundland. I haven't been in Nova Scotia as much, so I can't comment there, but you'd see people come in for a second opinion. They were told they need 10 fillings, and I'm sitting there, you know, I'm scratching my head, and I'm like, you know, I'm not seeing it. You know, I see one, maybe two or something like that, but you're kind of wondering how these things can happen and how there can be so little oversight in the profession, and it really erodes people's trust. And it makes it so that they approach going to the dentist like they do going to a used car salesman. And it's something that we need to look at, building a universal dental plan along, you know, public ownership, all of this stuff. We need to look at this as rebuilding that trust so that people feel like dental care is healthcare, not just some other commodity that's bought and sold. It's not some luxury thing. It's something that people deserve.
Yeah. Yeah, I definitely, I think, yeah, I think that there's a number of puns related to eroding trust and getting to the root of this problem, but I really appreciate that. You know, I really am looking forward to the day, and hopefully we can build the power collectively to do this, where we have a system of publicly funded clinics. We have, you know, children receiving care. Like, that's really the world that I want to live in. And you know, I think this wasn't an area where I've done extensive research or anything like that. So I'm certainly sure that some of the viewers who are watching this appreciate your really insightful comments about the state of things, where we're going to next, and how we get there. So thank you both very, very much for coming tonight, taking some of your time. Thank you for joining us from Ontario. Thank you for joining us from another part of Nova Scotia. And I really appreciate you taking the time to sort of lay this vision out. Where can folks find you if they want to get involved in fighting for dental care? Where can folks get involved for improving medical care and Medicare across Canada? Obviously, there's partisan implications, but you folks have both taken the time to come here and admirably represent your own organizations.
Yes, if people want to join the Coalition for Dental Care, they can message us either on Facebook, Instagram, or Twitter. We're still in the process of getting our website set up. Yeah, we're really happy to have anyone from, you know, whatever background, whoever's interested, we're happy to have the help.
And similarly, you know, if you Google Canadian Doctors for Medicare, you'll see our organization. You can find us on Twitter as well. And yeah, we're always happy to talk more about how we strengthen our Medicare system.
Great. All right, thank you so much. This has been going live about dental care for all. We're going to leave this video up as we do for all of these. So if you are watching this later and you get to the end, feel free to reach out if you have any questions or comments, and definitely give these two organizations a look. You know, I really want to see the NSNDP's plan happen as a first step. So, you know, come out, knock doors with me. I'm never going to say no to a volunteer, but absolutely join these other organizations and fight to push these things further, because we said it earlier, there's going to be pushback. We can expect there to be pushback. And, you know, when we improve our universal systems, everyone is going to benefit. So we're definitely counting on you folks to get out there and do the work alongside us. So thank you very much to both of you. Thank you everyone who's watching this now, who are watching this later, and let's get our teeth taken care of and build a society that has dental care.
Thanks so much.
Take care, everyone.
Take care.